Hi, my name is Eran Ben-Arye. I'm a clinical associate professor from the Technion Institute of Technology, Israel, and I'm a regional ambassador to Europe and the Middle East of the Society for Integrative Oncology. My presentation would present the SIO, the Society for Integrative Oncology, from a patient-centered, evidence-based, interdisciplinary perspective. So first of all, where I'm coming from Israel, from the Middle East, in between the ancient civilizations of Egypt and Mesopotamia, and from the east to west axis, going from Hippocrates to the Yellow Emperor in China, and Charaka and Sushruta in Ayurvedic medicine in India, and in between Islamic, Arabic medicine, what we call Greco-Arab medicine, and traditional medicine coming from the east, from the west, from the north, and from the south. And that's where we currently see our patients in the Integrative Oncology program in Haifa, northern Israel. And it's a big opportunity to see people, to experience cross-cultural barriers and interactions. And I would say that meeting patients in Europe and in the Middle East is about health belief model related to traditional medicine, to evidence-based medicine with an emphasis on patient-centered and treatment-tailored treatment, and a paradigm shift from a dichotomy of alternative versus complementary and conventional medicine to what we call today integrative medicine. So the Society for Integrative Oncology was founded in 2003. We are 600 members from 51 countries, represented by scholars, from clinicians, researchers, medical educators from North America, South America, Europe, Africa, Asia, Australia, and so on. The definition of the SIO to integrative oncology is about a patient-centered, evidence-informed field of cancer care that utilizes mind-body practices, natural products, and lifestyle modifications from different traditions alongside conventional cancer treatments. It's also about the goals of integrative oncology, aims to optimize health, quality of life, and clinical outcomes, and that's very important, across the cancer care continuum, and to empower people to prevent cancer and become active participants before, during, and beyond cancer treatment. So the most important aspect of the SIO today, I would say, is the publication of guidelines about breast cancer, for example, treatment of breast cancer with integrative oncology. That's from the Journal of Clinical Oncology of 2018, endorsed by the American Society of Clinical Oncology, and the guideline from 2022 about integrative medicine for pain management in oncology, and that's a joint guideline of ASCO and the SAO. So this is the executive committee, the SAO EC persons led by Linda Carlson, the president, and other important. And beyond that, there is an ambassador program which emphasizes an international activity of the SIO. I'm the ambassador for Europe and the Middle East, and we have ambassadors for the UK and for Australia and Brazil, and more people are going to take part in this mission. We have started in Israel with the integrative oncology treatment in 2018. And the idea is that you can see here that there are three sectors in a program, in a clinical program. One is the integrative physicians. The second one are dual practitioners, for example, nurses, dietitians, psycho-oncologists, occupational therapists, and the integrative oncology, the IO practitioners, all specifically trained in integrative oncology. So, for example, you can see here a patient that came to our service. Her name was Salma, 36 years old, with advanced cancer, breast cancer, and she was referred, and that's typical, referral from the healthcare practitioners in the oncology department. It might be nurses, as in the case of Salma, or clinicians, physicians, or psycho-oncologists, or surgeons, and so on. So the first step is to have an intake, an integrative oncology 1-hour intake with an integrative physician, an IP, we call it, integrative physician. And this is the place where the treatment is designed and is co-shared by all members of the healthcare practitioners involved with the care of Salma, including the family physician, the surgeon, the oncologist, nurses, and so on. So the idea is that when we design a patient-tailored treatment, it involves elements of bio, psycho, social, spiritual, of course, evidence-based medicine. We take into account the patient's narrative and concerns, and then we tailor with the patient the treatment plan, which typically include weekly treatment with integrative oncology modalities like acupuncture or herbal medicine, nutrition, touch therapies, movement therapies, mind-body therapies, and so on. And you can see here the results of this patient-tailored integrative oncology approach published in the last years in the oncology and supportive palliative care literature. For example, alleviation of emotional distress in patients with high adherence to integrative care, weekly adherence, at least 6 to 12 weeks following the integrative physician intake. And you can see the comparison between the two groups with high and low adherence to integrative care. The same here in a study published in the BMJ Supportive and Palliative Care about alleviation of insomnia, which is very typical in our milieu, treatment of pain, especially with acupuncture, but with other modalities like anthroposophic medicine, mind-body, herbal medicine, and manual treatment. This is what happened following 6 weeks, a significant improvement in pain in patients with localized disease, and here, improvement in patients with advanced disease undergoing palliative oncology care. This is a randomized control trial comparing different groups with controls and groups receiving acupuncture alone or with multimodal integrative oncology treatments in alleviation of chemotherapy-induced peripheral neuropathy, published in Cancer with less pain and much more functioning. The treatment leads, the integrative oncology treatments lead not only to quality of life improvement, but to enhanced adherence to the chemotherapy protocol. We have seen it with patients undergoing breast and gynecological cancer chemotherapy, and especially with it's a specific effect with chemotherapies which have limited conventional or palliative care treatment, like carboplatin or platins and taxanes that induce CIPN, the chemotherapy-induced peripheral neuropathy. Another aspect is the enhanced impact on survival. That's curves where we compare patients with advanced ovarian and endometrial cancer with high adherence, low adherence, and control. And you can see on the Kaplan-Meier curve enhanced survival for 12 months, 18, and 36 months. And another impact is on the admissions in this group of patients, severely ill patients, on the ER visits to the emergency room. So integrative gynecological oncology is one of our little models of care. And you can see here a picture from the operation of GYN oncology patients where we offer intra-operative acupuncture in the middle of the surgery. And in order to do that, it's not only a good connections and rapport with the patient, but it's a team effort. It's a multidisciplinary effort where the GYN oncologists and surgeons collaborate with the nurses, with the psycho-oncologist, with the palliative care specialist. And this indeed has results. And this is, again, from cancer, about the effect of acupuncture during gynecological oncology surgery, with an impact on pain and anxiety, a significant impact. And that's the editorial that was published after that. But the impact is not only about quality of life, it's also about objective parameters during the surgery. You can see here that Group A receiving intraoperative acupuncture have better mean arterial pressure during the surgery, better heart rate, and B-spectral index, which says something about the EEG activity during the surgery. But along this success, there are a lot of barriers that we have identified about integration of traditional medicine in supportive cancer care in minority groups like the Arab population in northern Israel. And for that, it's important to acknowledge, and that's highly important to Europe as well. It's not just a Middle Eastern or African problem. You're facing that with the people. There are more and more people that comes from the Middle East and North Africa and other regional areas in the world to Europe, and you would need to encounter with that. So it's about the mission of integrative oncology practitioners to reframe patients' expectations. Usually people with high affinity to traditional medicine think about, or they have expectation of cure, and they seek treatment outside of the oncology service, specifically with herbal medicine. And in the integrative oncology setting, we are trying to reframe that, to emphasize more quality of life and not this cure expectation. We do integrate that within the oncology center and not outside that, and our treatment is multimodal. So these expectations and this model was published in the Annals of Oncology a few years ago, and it's a collaboration that includes 16 countries in the Middle East, published in Cancer, including also something about the safety concerns when you don't have an integrative physician who is orchestrating the program. Awareness of cross-cultural communicational barriers, and that's specifically regarding the refugee crisis in Europe that you have experienced in the last years, especially with people coming from Syria and from Iraq. And this is about a workshop that we did in Berlin about the refugees in conflict and the bridge that integrative oncology can offer in between conventional and traditional medicine. And this line of multidisciplinary collaboration needs a multidisciplinary medical education involving also physicians and nurses and integrative physicians and paramedical therapists. And we do that in Germany and in Italy and other countries, international medical education initiatives, which were published. This is something that we did in a training that we did in 2019 in Haifa, which was in collaboration with IVAA and the Middle East Cancer Consortium and the Italian Artoi and so on. And this is in Switzerland, a meeting a few years ago to design an international research collaboration involving Israel and Egypt and Jordan and Palestine, Turkey, Iran, Germany, Italy, and more additional members from the European community. So it's an ongoing process that leads eventually to a place where we work together, where the conventional team, in this case, the palliative team in our hospital, works together with the integrative oncology practitioners, specifically trained in integrative oncology, and working together from both sides, the conventional and the integrative, leads to that precious moment when we touch patients, in this case, at the end of life, in a patient with hemato-oncology disease, and treat her with graciousness and with an evidence-based support. So that's where I'm coming from the fields of Alonei Abba or Waldheim in northern Israel. And maybe that's where we can go to together, develop this shared multidisciplinary collaboration involving the European initiatives in integrative oncology. I thank you very much for your attention.